Live, late-breaking, investigative. This is KCTV 5 News at 4.
Well, now that the kids are all back in school, they might be coming home complaining about having to have braces on, or maybe that other kids are sort of picking on them. But braces no longer have to be a social nightmare. In fact, they're kind of cool nowadays, let's face it. But joining us today is Dr. Oltjen from Oltjen Orthodontics here in the Metro to talk about major advances that have been made in braces, I know, since I was a kid. Thank you for joining us.
Nice to be here.
Let's go back in history first and talk about what we used to deal with.
Well, okay, so I anticipate you had braces at some point.
I did.
So Carolyn, what do you remember about braces from when you were a kid? I
remember pain, lots of pain, specifically when they got tightened or wires got changed or whatever.
Exactly.
And I just remember, but I remember it being great when it was all done because those eye teeth came down.
Exactly. That's kind of a consistent theme. Back in the old days, you know, bands on every tooth, a lot of discomfort, unattractive appliances, and I am so proud of my profession on what we've been able to accomplish over the last 30 years. And we've been able to eliminate this.
Yay.
And now we have, I would call these two kind of the standard of care. And kids, of course, can decorate their new braces with colors.
Oh, yeah, they can pick out the colors every time, sure.
Makes it a lot of fun. And then if you don't want to see the braces for the older teens or adults, we've got ceramic brackets now, which make the braces disappear more when they're on the outside.
Almost invisible, really. Yes. I mean, look at that. You just see that little wire, no big deal.
And, you know, so we've come a long ways, but people ask me, you know, where do we go from here? You know, we've got shorter treatment times now, way shorter than we had with the old appliances like that. It was a huge cost when these came out, but now braces are a lot more affordable to families because the treatment can be done in fewer appointments over a shorter period of time, and that value is passed on to the parents. So it is more affordable. There's a lot of interest in braces, but where do we go from here? Standard of care now. What's on the horizon? Where do we go from here?
Okay.
So
move these out.
Yes, move those out. So what I have here, this is called insignia. Okay. And what insignia is, do we have that video?
Yeah, it's right here is what we're seeing here. We also have some video, I believe, of this insignia. So how is this different?
Okay, the insignia is different because every single bracket is custom milled for the particular shape of that person's tooth, and the wires are custom made as well.
Oh gosh.
So this adds efficiency, less appointments, shorter times even than what we had before.
So about how long on average would you say with this?
It depends on the type of malocclusion, or the type of bite, because it's different depending upon how complex it is. But I would say this is going to save at least 2 or 3 appointments, maybe more, and that's valuable to parents. They're busy, their kids are busy, they don't want to take them out of school. So it offers new efficiencies that you don't see. And the brackets are placed with a custom, what we call a custom jig, where the brackets can be put on and they're put exactly in the right spot, so you can't goof up the placement.
And you can make them almost invisible. Well, they are invisible now too, because they can go on the inside, is that right?
Yeah, this is another system. This system is called incognito, and what's different about this system is that the braces, of course, are placed on the inside. Very attractive for adults, for older teens that need treatment, sports where, you know, there's not as many injuries because the braces aren't on the outside of the teeth. I
know we have some before and after pictures here that are kind of fascinating to see. Wow, what a difference this can make.
It's great new technology, all customized and more streamlined for the patients, and value for the parent and the patient.
Is this a little cheaper or about the same price?
No, this particular appliance is a little more expensive.
More expensive, okay.
Because it's completely customized. But over time, I expect that those costs will go down because they're new technologies.
Sure, like everything does. Wow, these before and afters are dramatic.
I think.
Look at that.
Yeah, you know, it's just going to go quicker, more efficient, less discomfort. It's a good way to go.
So it is more comfortable.
Yeah, because you don't have to go to one point and then the orthodontist see it, make bends to react to that, to go, because it's streamlined. You see the end result before you start. Computer program allows you, with all 3 of these, you view the end results before you ever begin.
Aha.
And this last
Kind of
one
fun to see.
is called Invisalign. I think a lot of people know what Invisalign is now. It's become popular, where the teeth are moved incrementally with thin, clear plastic
that
aligners.
That is removable.
Yeah,
you don't have to wear it all the time.
Pop them off, just like that. But the only reason I wanted to talk about this today is because this is now available for teens as well. There's what's called Invisalign Teen. So this can be used for minor, mild to moderate problems. It can't handle the same type of complexity that these can, but nonetheless, that's nice. It's removable, and I get patients ask me about this particular appliance all the time.
Dr. Oltjen, we're out of time. I know we could talk about this for days and days. There's so much for everybody.
Great.
Thank you so much for updating us on the new technology. Love to see it in action.